Hello, I am Aishwarya from Chest Research and Training. On the occasion of World Asthma Day, we have Dr. Sundeep Salvi with us, who is going to give us deeper insights into why asthma is an important disease and how we can take good care. So, I would like to ask you a few questions which are very important regarding asthma. So, why do you think World Asthma Day is celebrated?
Asthma is a chronic lung disease that affects children, middle-aged people, as well as the elderly. It is accompanied with a lot of suffering because of the symptoms that are associated with it, such as cough, shortness of breath, and chest tightness. Because of this, people suffer and have a very poor quality of life. Fortunately, asthma is a very easy disease to treat if it is diagnosed properly and if it is treated appropriately. Unfortunately, a large number of asthmatics do not get the benefit of this. And therefore, the World Asthma Day is intended to create awareness about what asthma is, how should you make a diagnosis of asthma, and what sort of treatment is most effective. So, for people to understand this better, the World Asthma Day is celebrated or recognized all over the world every year.
So, sir, is there a theme for this year?
Every year there is a new theme for the World Asthma Day, and for this year it is making inhaled medications accessible to all asthmatics. And the reason behind that is the most important treatment for asthma is inhalation therapy or using inhalers so that the drugs reach the airways or the portions of the lung where asthma occurs. Safest, fastest, and the most effective treatment for asthma. But sadly, the inhaled medications are not widely used by asthmatics. So, to create that awareness, making inhaled medications accessible for all asthmatics is a theme for this year.
Okay. So, how India is performing, sir, in asthma?
Asthma in India is in a very sorry state. A large number of asthmatics do not get the correct diagnosis. Because they do not get the correct diagnosis, they do not get the appropriate treatment. There are several reasons for this. The most important diagnostic tool for asthma, called spirometry, is not widely available. And therefore, doctors generally miss the diagnosis because of lack of access or availability of a spirometer. That is one. Second is 90% or more of asthmatics in India use oral medications, which we know is not as effective and is more harmful than the inhaled medications. The inhaled medications that are now currently recommended for asthma are the safest, fastest, and the most effective route of delivery for treating asthma. But sadly, that does not happen in India. And among the inhaled medications, the best medication to treat asthma are anti-inflammatory drugs called corticosteroids. So, inhaled corticosteroids become the most important treatment for asthma. That is one medication that can control the asthma completely and give you a near normal life. But sadly, a study that we conducted a few years ago showed that only 6 to 8% of asthmatics in India use inhaled corticosteroids. So, lack of use of a very important treatment is one of the main causes for why asthmatics in India suffer and are also more likely to die. In addition to that, there is another inhaler called salbutamol, which is called as a reliever medication. It gives you a very quick relief of symptoms. So as soon as you take the inhaler, the patient feels better and wants to take this every now and then when the symptoms occur. But the problem with the salbutamol inhaler is the duration is only for a few hours and it does not control the underlying inflammation. So if you only take the reliever medication for asthma, it is going to give you chronic inflammation in the lung. And that chronic inflammation is going to make your asthma worse over a period of time. Sadly, most asthmatics in India use only the reliever medication. And that, I believe, is a very important cause for why they continue to suffer and why asthmatics in India contribute to major asthma deaths. So this is a twofold problem. They don't use inhaled corticosteroids and they overuse inhaled salbutamol. So that is the state of affairs in India, and we need to change that. Every asthmatic in our country must get an inhaled corticosteroid as the most important treatment, and not only the reliever medication.
So, any key message that you would like to give to our healthcare workers?
So doctors who take care of asthma in our country must ensure that they make a correct diagnosis using either a spirometer or a peak flow meter at least. They should treat their asthmatic patients with inhaled corticosteroids as the most important treatment, and not treat them with a reliever inhaler or oral medication. As I said earlier, every asthmatic in India must be given an inhaled corticosteroid. And that is the responsibility of our healthcare providers. Make sure that all asthmatics get access to an inhaled corticosteroid. Asthma is also triggered by a whole host of different factors, and a doctor should ensure that these factors are explained to the patient and that the patient takes care of it. For example, exposure to dust or smoke of any kind inside the house or outside the house is going to trigger asthma. Simple things like using a mosquito coil or an incense stick or a dhoop agarbatti or any form of even a liquid mosquito repellent is going to trigger off the asthma. So avoiding all these. If you have wet walls or damp walls in the house, so because of water seepage, the fungus that grows on the wall is going to be an important triggering factor for asthma. So make sure that your house is clean and dry, so that the fungus doesn't grow inside. If their patients are overweight or obese, encourage them to lose weight, because being overweight and obese is a triggering factor or a risk factor for poor asthma control. The healthcare should ensure that all these factors that I've just mentioned should be used in their practice.
Sir, at the end, if you would like to say a few words or a key takeaway for our patients.
So, asthma, although it is a chronic disease of the lungs and the airways, we can easily control it and lead a near normal life if you take the medications regularly and correctly. Correctly, I mean all asthmatics should use inhalation therapy or inhalers to treat the inflammation that is present in the airways. So, inhaled corticosteroids, remember, is the most important treatment for your asthma. If you're using an inhaled reliever medication that contains salbutamol, use it only if and when you have a problem, not on a regular basis. Make sure that that is only an add-on medication that is used for asthma. There are a lot of triggering factors that can make your asthma worse, so avoid them as far as possible. Factors that are present inside your house or even outside the house, such as exposure to air pollution and so on. If you go out, always wear a mask and go out, because that is going to reduce the number of pollutants that enter into your lungs to trigger off your asthma attacks. At home, keep your house neat and clean. Make sure that there are no damp walls or wet walls where fungus can grow, and have a healthy diet that comprises of vegetables as well as fruits on a daily basis, so that can improve the health of your lungs. Remember that asthma is a very easy disease to control if you do the right things.